Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another classification, that is a classification number 34. Antibacterial drugs which inhibit the protein synthesis or antibiotics which inhibit the protein synthesis. Now this classification is very important for your upcoming GPAT Niper DI Pharmacist exam. So it's my request to you, please watch this video until end. And believe me, I will try to cover at least 5 or 6 probable questions in upcoming exam. My dear students, we have already seen 33 videos on the classification part. If anybody has not seen previous videos, please go in the channel's playlist and watch all the classification videos, because they are very important for your GPAT Niper DI Pharmacist exam. And believe me, a lot of MCQs they are going to be covered just by watching these classification videos. There is a reason behind that, because in those videos I have not only explained you the classification, but also I have told you some important points which are really important for these exams. My dear students, first of all I would like to revise you certain classes of drugs which affect on different targets of bacteria. I would like to revise you mechanism of action of antimicrobial drug. सर्टन एंटीबैक्टीरियल ड्रग्स, कुछ एंटीबायोटिक्स वो सेल वॉल के ऊपर एक्ट होते हैं, कुछ एंटीबायोटिक्स दे विल इनहिबिट द प्रोटीन सिंथेसिस, कुछ एंटीबायोटिक्स न्यूक्लिक एसिड सिंथेसिस को इनहिबिट करते हैं, कुछ एंटीबायोटिक्स फोलिक एसिड सिंथेसिस का इनहिबिट करते हैं. सो विल सी वन बाय वन. फर्स्ट टारगेट फॉर एंटीबैक्टीरियल एजेंट इज नथिंग बट सेल वॉल. सो एंटीबैक्टीरियल एजेंट्स और एंटीबायोटिक्स which inhibit the cell wall synthesis, for example penicillin, cephalosporins, imipenem, meropenem, azithromycin. We have already seen the classification of penicillin, cephalosporins. Please go and watch this classification also. Now imipenem, meropenem, azithromycin. Azithromycin is known as a monobacterium, right? Now next one is a vancomycin. Now what is vancomycin? Vancomycin is an antifungal drug. We have already seen the classification of antifungal drugs also. So please go and watch those videos also. Vancomycin will create pores in the membrane of cell wall of the bacteria. So it will create pores or holes that leads to leakage of content inside cell content into outside. That leads to death of bacteria or the death of fungus. So vancomycin being an antifungal drug, it creates a pores in the membrane, cell membrane, right? Now penicillin, cephalosporins, all the beta-lactam antibiotics, they inhibit synthesis of peptidoglycan. That is a cell wall synthesis. Okay. Now those antibacterial drugs which inhibit the protein synthesis known as a aminoglycosides, chloramphenicol, macrolides, tetracyclines, streptogramine and linezolid. So we are going to see the classification of these drugs in the detail in our today's session. Third target for your antibacterial drug is nothing but the nucleic acid. So fluoroquinolones, rifampin. So ये जो antibiotics है, they will inhibit the synthesis of DNA in the bacteria. So fluoroquinolones, particularly ciprofloxacin, ofloxacin, levofloxacin, moxifloxacin, all these are known as a DNA gyrase inhibitor. They will prevent the negative supercoiling of your DNA of bacteria after replication. जब replication होगा उसके बाद में जो DNA बनेगा, एक साइड पे supercoiling हो जाता है, एक साइड पे DNA बनता है. तो जो supercoiling हो चुका है उसका वो रिलीव करना पड़ता है. So fluoroquinolones will prevent the negative supercoiling by inhibiting the DNA gyrase enzyme or DNA topoisomerase enzyme. Then rifampin is an anti-tubercular drug which inhibit the RNA dependent DNA polymerase enzyme, right? And inhibit the synthesis of nucleic acid. Now antibiotics or they are known as a chemotherapeutic agents, sulfonamides, trimethoprim, pyrimethamine. They are known as a chemotherapeutic agent because they inhibit the synthesis of folic acid in the bacteria, right? Now these are the different mechanism of action of antimicrobial drug. So you have to remember this. I have revised. Now we'll see the next part, mechanism of protein synthesis inhibition. So to understand the mechanism of action of protein synthesis inhibitor drugs or antibiotics which inhibit the protein synthesis, if you want to understand the mechanism of action, so you should be clear regarding the biochemistry, the process of protein synthesis. So there are different steps of protein synthesis in the biochemistry you might have seen. So first step in the protein synthesis of protein synthesis in the prokaryotes. So that is known as a formation of ternary complex or formation of initiation complex. The second step is nothing but the incorporation of amino acid. Third step is nothing but the formation of peptide bond. Fourth step is nothing but the translocation. Now, if you want to revise your protein synthesis, you can go in our channel's playlist of biochemistry and you will have video over there, full video on the protein synthesis. What are the drugs which affect the formation of initiation complex? So these are the drugs which affect the formation of initiation complex. So aminoglycosides, they binds with 30th ribosome, 30th ribosomal subunit, because जो प्रोकैरियोटिक राइबोसोम होता है that is known as 70th राइबोसोम. वो 70th होता है, उसमें 30th एक पार्ट होता है, 50th एक पार्ट होता है, right? So aminoglycoside bind to the 30th part, lineage or lead, and macrolides they bind to 50th part. Chloramphenicol also bind to 50th ribosomal subunit of the bacteria, right? These drugs interfere with the codon function. Particularly aminoglycosides interfere with the codon function by binding with the 30th ribosomal subunit. Association of 50th ribosomal subunit with the mRNA. Okay, so they prevent the formation of initiation complex. So initiation complex means what? So 30th ribosomal subunit containing mRNA, 50th ribosomal subunit containing tRNA, right? So formation of this complex, that is initiation complex, is prevented by this drug. Now some of these drugs will cause misreading of DNA code. So particularly aminoglycoside, they cause misreading of mRNA and incorporation of wrong amino acid that leads to a sidal effect, okay, or bactericidal effect. So those prevent the formation of initiation complex. They are the bacteriostatic in nature. Those incorporate wrong amino acid, those incorporate or those fills wrong amino acid in the protein, they leads to their action is a sidal action. Now drugs which affect the incorporation of amino acid in the protein, तो incorporation of amino acid को कौन inhibit करने वाला है? So tetracyclines, then streptogramins. So streptogramins like diflopristine, quinopristine. So they are known as streptogramins. Tetracyclines, you know, they binds to 30th ribosomal subunit, and streptogramins they binds to 50th ribosomal subunit. Now they block the attachment of amino acid acyl tRNA. Amino acyl tRNA जो होता है उसको ये block करेंगे. It blocks the attachment of amino acyl tRNA to the acceptor site, and that is a static action. So they are bacteriostatic. So tetracyclines क्या है? Bacteriostatic है, bactericidal नहीं. But aminoglycoside क्या है? Bacteriostatic भी है and bactericidal भी है, right? Now third step, formation of peptide bond. Now that is affected by these drugs known as a chloramphenicol. So what is chloramphenicol? It binds, it is a broad spectrum. It binds to 50th ribosomal subunit of bacteria. It inhibits the one enzyme known as a peptidyl transferase. It inhibits the enzyme known as a peptidyl transferase. Now what is the function of this enzyme? Formation of peptide bond. Okay, in the upcoming amino acid and previous amino acid, there is a formation of peptide bond that is catalyzed by this peptidyl transferase, and that is inhibited by chloramphenicol. इसके ऊपर क्वेश्चन आ चुका है, right? Everything, what is important? Everything or every line, whatever I am telling you, that is very very important. Question हर बार आ चुका है. So I am not explaining you हर time. हर बार कहाँ से क्वेश्चन आया ये नहीं बोलूँगा. Now next is nothing but the translocation step. Those drugs which affect the translocation, or those antibiotics which affect the translocation, they are known as the macrolides, clindamycin, etc. etc. Macrolides and lincosamides. So clindamycin is a derivative of lincosamide. Okay, so lincosamides in that clindamycin is there. Okay, so macrolides, clindamycin, they binds to the 50th ribosomal subunit and inhibit the translocation of peptidyl tRNA from the acceptor side to the donor side. That leads to its static action, right? So these are the different events that occurs in the protein synthesis. Now antibacterial drugs which inhibit the protein synthesis, they either act on the formation of initiation complex, either they act on a amino acid incorporation, either they act on a formation of peptide bond, or either they act on a translocation, right? Now we'll see the classification. Antibiotic, those which are a protein synthesis inhibitor. Now in this classification I have tried to explain you a lot of things. So first we'll see the different classes of drugs which inhibit the protein synthesis in the bacteria. Now first class that is known as the macrolides. जो पहला class होता है antibacterial drugs that inhibit the protein synthesis. पहला class होता है macrolides. Second class is nothing but the aminoglycosides. Third class is nothing but the tetracyclines. Tetracyclines are nothing but the third class. Now fourth class is nothing but the chloramphenicol. Fifth class is nothing but the this. Okay. So we'll see this classification one by one. Now first is nothing but the macrolides. Macrolides. So why they are known as the macrolides? Because they will have a large lactone ring in their structure. They will have a large lactone ring in their structure, and that's why they are known as the macrolides. Now they are a narrow spectrum antibacterial drug. They are a narrow spectrum and bacteriostatic drug. Mechanism of action क्या है उनका? They binds with the 50S ribosomal subunit and inhibit the protein synthesis. Now what is the source of this macrolide antibiotic? ये कहाँ से आता है? So macrolide antibiotic like streptomycin, it is obtained from the Streptomyces erythrus. Streptomyces erythrus, that is the source. Now examples of macrolide antibiotics. So macrolide antibacterial drugs, they are classified into two types. First, macrolides. So in that you will have erythromycin, azithromycin, roxithromycin, clarithromycin. Okay. Now second is known as the ketolides. Ketolides. In that you have telithromycin. इसके ऊपर question आ चुका है. So ketolide is nothing but the telithromycin. Macrolides are nothing but the erythromycin, azithromycin, roxithromycin, and clarithromycin. Remember, clarithromycin is the antibiotic choice. Clarithromycin is the antibiotic of choice in case of H. pylori infection in the ulcers. Right. Now, what are the adverse drug reaction of these macrolide antibiotics? इनके adverse drug reaction क्या होंगे? So they cause hepatitis, cholestatic jaundice, diarrhea, and diarrhea is due to the blockage of motilin receptor in the GIT. आपके GIT में motilin receptor होते हैं, that is responsible for the motility. So by blocking of this receptor, they causes the diarrhea, motilin receptor. Okay. Now also they can cause ototoxicity, and some of them also have potential risk of cardiac arrhythmia. So I have told you regarding macrolides. I think I have covered a lot of points. Now we'll see the second class, that is nothing but the aminoglycosides. Now why they are known as aminoglycosides? So because in that lot of amino sugars are there. So amino sugars, they are linked with the another amino sugar by a peptide bond or by a glycosidic bond. Amino sugars, they are linked to a glycoside, to a sugars by glycosidic bond. So that's why they are known as the aminoglycosides. So in that you have a lot of drugs. So they are known as a narrow spectrum and antibacterial drug. They are a bacteriostatic in nature. Now what is the mechanism of action? They binds to the 30th ribosomal subunit. They binds to the 30th ribosomal subunit and inhibit the protein synthesis. Now इसका source क्या है? What is the source of aminoglycosides? They are obtained from the soil, from the actinomycete species, and particularly from the Streptomyces genus. Okay? Now, depending upon the genus of actinomycetes, they are classified in a different type. So those drugs which are obtained from Streptomyces genus. Streptomyces genus से कौन मिलता है? Okay? So in that you have streptomycin, kanamycin, neomycin, topramycin. So they are the streptomycins. They are derived from the Streptomyces genus, right? Now those derived from the Micromonospora genus, they are known as the mycins. तो जो Streptomyces genus से मिलता है, उनके end में क्या होगा? Mycins होगा. You can see here, MYCIN, mycin. Okay, mycin. Okay, so streptomycin, kanamycin, neomycin, topramycin, and streptomycin, kanamycin, neomycin, topramycin. Now those drugs which are isolated from Micromonospora genus, they are known as the mycins. So gentamicin, then cecomycin. Okay. Now in that also third category is there, semi-synthetic aminoglycosides. So in that you have amikacin and netilmicin. Amikacin, netilmicin, they are known as semi-synthetic. Now adverse drug reactions of aminoglycosides, तो आपको मालूम होना चाहिए common adverse effects are there. So they will cause nephrotoxicity, they will cause ototoxicity, they will cause deafness due to ototoxicity. So they damage the 8th cranial nerve. They can cause ototoxicity, deafness, and they also block the neuromuscular junction. So nephrotoxicity, ototoxicity, deafness, neuromuscular blocking. These are the adverse effects of aminoglycosides. So first class was the macrolides. We have seen about the macrolides. Second class was the aminoglycoside. We have seen about the aminoglycoside. Now third class is nothing but the tetracyclines. Why they are known as the tetracyclines? Because they have four rings in their structure. That's why tetracyclines. So they have two naphthalene ring joined together. Okay, that's why tetracyclines. Now they are a broad spectrum antibiotics or broad spectrum antibacterial drugs. Okay, they are a bacteriostatic in nature. They bind to the 30th ribosomal subunit and inhibit the protein synthesis. Right. Now, ये कहाँ से मिलता है? What is the source? Again, they are often from actinomycetes, soil actinomycetes. Source is soil. Now, in that you have tetracyclines, first class. So, in tetracyclines you have tetracycline, chlorotetracycline, oxytetracycline. So, you can remember OTC drugs. But they are not a OTC drugs. Trick is there, OTC. So, OTC means oxytetracycline, tetracycline and chlorotetracycline. Now, semi-synthetic tetracycline derivative. दूसरा आता है आपका सेमी-सिंथेटिक टेट्रासाइक्लिन डेरिवेटिव. इन दैट यू हैव मिनोसाइक्लिन एंड डॉक्सीसाइक्लिन, डेमेक्लोसाइक्लिन, मिनोसाइक्लिन, डॉक्सीसाइक्लिन एंड डेमेक्लोसाइक्लिन. एडवर्स रिएक्शन क्या होंगे टेट्रासाइक्लिन के? दे कॉजेज द हिपेटोटॉक्सिसिटी, दे कॉजेज द हिपेटोटॉक्सिसिटी, दे कॉजेज द हिपेटोटॉक्सिसिटी, दे कॉजेज द टेराटोजेनिसिटी, दे हैव एंटी एनाबॉलिक इफेक्ट, हिपेटोटॉक्सिसिटी, नेफ्रोटॉक्सिसिटी, फैंकोनी सिंड्रोम. इसके ऊपर क्वेश्चन आ चुका है. टेट्रासाइक्लिन्स कैन कॉज फैंकोनी सिंड्रोम. देन दे आर टेराटोजेनिक इन नेचर. दे विल decrease the calcification of bones, calcification of teeth. Then they also have phototoxicity as an adverse effect. Tetracyclines are a drug of choice in case of, उनका use क्या है? They are a drug of choice in case of rickettsial infection, chlamydial infection, mycoplasma pneumonia, brucellosis. They are drug of choice in the cholera infection. Remember, doxycycline is a drug of choice in the traveler's diarrhea. Doxycycline is a drug of choice in the traveler's diarrhea. तो इसके ऊपर भी क्वेश्चन आ चुका है. फैंकोनी सिंड्रोम के ऊपर क्वेश्चन आ चुका है. सो मैकेनिज्म के ऊपर क्वेश्चन. सो ईच एंड एवरीथिंग व्हाटएवर आई टोल्ड इज इंपॉर्टेंट. ओके, नाउ वी हैव सीन द थ्री क्लासेस ऑफ ड्रग व्हिच अफेक्ट द प्रोटीन सिंथेसिस इन द बैक्टीरिया. नाउ फोर्थ क्लास ऑफ ड्रग, ओके, नोन एज अ क्लोराम्फेनिकोल. अगेन क्लोराम्फेनिकोल इज अ अमीनो phenol derivative. It is a amino phenol derivative, chloramphenicol. What is the source? It is obtained from Streptomyces venezuelae. Streptomyces venezuelae. Okay, source important है, क्वेश्चन आ चुका है. Streptomyces venezuelae. Okay, chloramphenicol का source Streptomyces venezuelae. Now it is a broad spectrum antibiotic. So it binds to the 50th ribosomal subunit and inhibit the protein synthesis by inhibiting one enzyme known as a peptidyl transferase. Question इसके ऊपर आ चुका है. It inhibits the enzyme peptidyl transferase. Okay. Now, what are the adverse reactions of this chloramphenicol? So, gray baby syndrome, major adverse effect. Question इसके ऊपर आ चुका है. It suppresses the bone marrow. So, suppression of bone marrow that leads to aplastic anemia. Again, another adverse effect. Aplastic anemia. And this chloramphenicol can cause idiosyncratic reactions. Fifth class of antibiotic which inhibit the protein synthesis. They are known as a fluoromethylanes. In that you have retapamylins, which inhibit the protein synthesis by binding to a 50th ribosomal subunit, and it is used in the methicillin-resistant Staphylococcus aureus infections, particularly impetigo. Now, again, another class of antibiotic which inhibit the protein synthesis. You can say it is a sixth class. Okay, so streptogramins. In that you have example quinopristine, daplopristine, and daplopristine. So they are known as streptogramin. They also inhibit the protein synthesis in the bacteria by binding to a 50th ribosomal subunit. Right. Now again, linezolid also inhibit the 50 protein synthesis by binding to a 50th ribosomal subunit. So if there is a tetracycline resistance, so linezolid is used. So if other drugs are resistant, so then linezolid is used. Then lincomycins. In that you have clindamycin and lincosamine. Lincomycins in that clindamycin and lincomycin. So clindamycin is used in the treatment of acne vulgaris. जो लेडीज के चेहरे के ऊपर जो एक्ने होता है, जो फोड़े आते हैं, So in that treatment, clindamycin is the drug used for that. Okay. Then lincomycin is also, they also acts by similar way. Okay. So this is nothing but the different classes of drug. So macrolides first, then aminoglycoside second, tetracyclines third, chlorphenicol 4, pleuromethyls 5, streptogramins 6, and lincosamides 7. Lincomycin 7. So there are 7 classes of antibiotics which affect the protein synthesis in the bacteria. Okay. So we'll see the next point now. Okay. So you can see the mechanism of action of macrolides. So by binding to a 30S ribosome, by binding to a 50S ribosome, they inhibit the translocation of growing peptide chain from A site to P site. So there are different sites: A site, P site, E site. Okay. So these macrolide antibiotics, they binds to the 50S ribosomal somatin and prevent the translocation from the A site to the P site. Now we'll see the mechanism of action of aminoglycosides. So aminoglycosides, they again binds to the 30S ribosomal subunit. Aminoglycoside bind to the 30S ribosomal subunit and block the initiation of protein synthesis. So initiation complex. Again also they causes the misreading of DNA, misreading of mRNA and terminate the protein synthesis. Also they causes the, in addition to that, they causes the incorporation of faulty amino acids in the growing peptide chain. That's why they are a bacteriostatic as well as bactericidal. Now we'll see the mechanism of action of chloramphenicol and tetracyclines. Chloramphenicol will bind to the 50S ribosomal subunit. Chloramphenicol will bind to the 50S ribosomal subunit on P side and inhibit the transpeptidase reaction or enzyme. Now tetracyclines will bind to the 30S ribosomal subunit, inhibit the protein synthesis. Okay, it binds to tRNA at A sites and mRNA ribosomal complex, prevent the protein synthesis. Right. Now we'll see next part, that is a mechanism of resistance to the antibacterial drugs. ये antibiotics क्या है कि due to irrational use, due to regular use of antibiotics, bacteria develops a resistance. So due to irrational use of antibacterial drugs, there is a development of resistance. So what are the different mechanisms through which bacteria will develop the resistance to the penicillins and cephalosporins? Bacteria will develop resistance to the penicillins and cephalosporins. Either first bacteria will produce a beta lactamase. तो bacteria ससुरा beta lactamase नाम का एंजाइम जो है, that beta lactamase opens the ring, beta lactam ring, and makes beta lactam antibiotic ineffective. So bacteria क्या करेगा, आप में खुद में ऐसा जो एंजाइम है उसको प्रोड्यूस करेगा, beta lactamase, that will cleave the beta lactam ring. Now also bacteria will develop certain change in the penicillin binding protein. जो penicillin जिस प्रोटीन को बाइंड करता है, उसमें कुछ चेंजेस आएगा. So bacteria will make change in the penicillin binding protein and also change in the porins. So that's how bacteria will develop a resistance to the penicillins. Now how bacteria will develop resistance to the aminoglycosides like streptomycin, gentamicin, amikacin? So there is a formation of enzyme which inactivates the bacteria. ऐसा एंजाइम डेवलप करेगा कि aminoglycoside को इनएक्टिवेट करने वाला via conjugation reaction. Okay, that is a transfer of acetyl, phosphoryl and adenyl groups. तो ये जो aminoglycosides में groups होते हैं, बैक्टीरिया एक ऐसा एंजाइम बनता है कि वो इनएक्टिवेट करता है इन एंटीबायोटिक्स को by conjugation reaction that transfers acetyl, phosphoryl and adenyl groups to the antibiotic, which render the antibiotics ineffective. Now how bacteria will develop a resistance to the macrolide antibiotic? Okay, to the macrolide antibiotic. Question आता है mechanism of resistance. So macrolide antibiotic like azithromycin, erythromycin, clarithromycin, clindamycin. Clindamycin is known as a lincosamides or lincomycin. So bacteria will develop a resistance to this macrolide and lincomycins by forming one enzyme known as a methyl transferase that alters the drug binding site on the 50S ribosomal subunit and also develops an active transport, takes drugs out of cell. Now, how bacteria will develop a resistance to the tetracyclines? Bacteria will develop resistance to the tetracyclines by developing the transport सिस्टम. बैक्टीरिया खुद में ऐसा एक पंप बनाएगा जो ड्रग को बाहर फेंक देगा. सो इंक्रीज द एक्टिविटी ऑफ ट्रांसपोर्ट सिस्टम, दैट इज अ पंप. ड्रग्स आउट ऑफ सेल. ओके, पंप drugs out of cell means that pumps drags the drug out of cell, right? Now, how drugs will develop a resistance to the sulfonamides? So change in the sensitivity to the inhibition of target enzyme means जो target enzyme होता है आपका folic acid synthase enzyme in the bacteria, so there is a decreased sensitivity to that enzyme, so synthesis of little bit different enzyme which are less sensitive to the sulfonamides. सो बैक्टीरिया क्या करता है कि जो फोलिक एसिड सिंथेरेज नाम का एंजाइम है जिसके सल्फोनामाइड उसको इनहिबिट करता है, तो वो एंजाइम को ही थोड़ा चेंज कर देता है ताकि सल्फोनामाइड का सेंसिटिविटी कम हो जाए. अगेन इंक्रीज द फॉर्मेशन ऑफ पाबा. ठीक है, एक तो ये करता है या फिर पाबा का फॉर्मेशन और पाबा का प्रोडक्शन बढ़ा देता है, या फिर यूज ऑफ एक्सोजेनस फोलिक एसिड. नॉर्मली बैक्टीरिया इज नॉट एबल टू यूज एक्सोजेनस फोलिक एसिड और बैक्टीरिया विल नॉट यूटिलाइज ऑलरेडी फॉर्म्ड फोलिक एसिड और प्री फॉर्म्ड फोलिक एसिड. रेजिस्टेंस में क्या होता है कि ये ऐसा सिस्टम डेवलप कर देता है कि रेडीमेड फोलिक एसिड भी उसको यूटिलाइज कर देता है. नाउ बैक्टीरिया विल डेवलप रेजिस्टेंस टू द फ्लोरोकिनेज बाय चेंजिंग इन द सेंसिटिविटी टू द इनहिबिशन ऑफ टारगेट एंजाइम. मतलब जो ये डीएनए काइनेज एंजाइम उसका सेंसिटिविटी कम हो जाएगा. इंक्रीज द एक्टिविटी ऑफ ट्रांसपोर्ट सिस्टम दैट प्रमोट्स द इफ्लक्स, ड्रग इफ्लक्स. ड्रग को बाहर फेंक देने वाला कोई ट्रांसपोर्ट सिस्टम बना देगा. दैट्स हाउ बैक्टीरिया विल डेवलप resistance to the fluoroquinones. How bacteria will develop resistance to chloramphenicol? So formation of inactivating acetyl transferase. बैक्टीरिया क्या करता है, आपने इसमें एक acetyl transferase एंजाइम बना देता है, वो क्या करता है इनएक्टिवेट कर देता है chloramphenicol. So these are the different mechanism of resistance of antibacterial drug. Mechanism of resistance to the antibacterial drug. तो due to irrational use आप क्या करते हो, आपको सर्दी खांसी हो गया, गले में खराश है, आप जाते हो मेडिकल वाले के पास और डायरेक्टली बोलते हो कि मुझे इरिथ्रोमाइसिन दे दो. आपको मालूम ही नहीं कि कौन सा बैक्टीरिया ने आपको इन्फेक्ट किया है, डोज कितना है. ड्यू टू इरेशनल यूज ऑफ एंटीबायोटिक्स, व्हाट इज हैपनिंग? सो दिस बैक्टीरिया, दिस पैथोजेंस, दे आर डेवलपिंग रेजिस्टेंस टू द एंटीबैक्टीरियल ड्रग्स. नाउ these are the mechanisms how they can develop a resistance to the which kind of antibacterial drug, right? You can order this magic bullet for GPAT Niper DI Pharmacist exam preparation. Read twice and qualify 100%. You can see we have very much promising results. Thousands of students they are placed in the Niper. You can also join our GPAT Niper 2024-25 online crash course where you will have live lectures, recorded lectures, study material in the form of hard copy. Lectures will be subject wise and chapter wise. Online test series will also be there. And if you get all India rank 20, if you get all India rank below 20, the fees 8,000, which is a piece of course that will be returned to you in the form of reward.
Hello students, order the magic bullet for GPAT Niper Drug Inspector. Read twice and